You know, a drug overdose? It's one of the most chaotic scenes you can imagine in emergency medicine. But what if I told you that what looks like pure chaos is often met with a systematic, life-saving playbook? Let's break down how responders turn that crisis into a clear course of action.
Okay, so picture this. You're the first responder on the scene. You've got an unconscious patient and you're pretty sure it's an overdose. What do you do first? What's that absolute first step? The answer? Well, it might surprise you, but it is absolutely critical. So here's the thing. The real challenge here is just the sheer number of possibilities. We're talking about countless drugs, different chemicals, poisons, you name it. And each one has its own nasty set of effects. The pressure is on and you just can't afford to guess.
And this is where it gets kind of counterintuitive. The first thing you do is not try to figure out what drug they took. I know, right? So if it's not identifying the substance, then what on earth is it?
It all comes down to the ABCs. This is the universal, rock-solid first response for any patient in this kind of trouble, no matter what caused it. This is step 1, 2, and 3 of the playbook, all rolled into one. So let's dive in.
Okay, so first up, A is for airway. Super simple. Can they breathe? Is there a clear passage for air? Then you've got B for breathing. Are they actually breathing? And if they are, how well are they doing it? This is where responders might have to give them oxygen or even breathe for them. And finally, C is for circulation. You know, the basics. Does their heart have a beat? Is there a pulse? This whole step is about keeping that blood flowing to all the important places. And this quote just nails the whole philosophy here. You treat the patient, not the poison. Think about it. Getting a definitive lab result to figure out a drug can take a long time. We're talking minutes, maybe even hours. And that is time a patient who isn't breathing just doesn't have. Securing those ABCs buys that precious time. It makes everything else possible. All right, so once the patient is stable, once those ABCs are locked down, now the game changes. This is where we get to play medical detective and start piecing together the clues.
And the number one tool in our detective kit is something called a toxidrome. It sounds super technical, but the idea is actually pretty simple. It's just a group of symptoms that when you see them all together, point to a specific class of drug. It's like the drug leaves behind a fingerprint at the scene.
And check this out. This is a perfect example of just how powerful toxidromes can be. Just by looking at one simple thing, the patient's pupils. An opioid overdose, that's going to cause miosis. We're talking pinpoint, constricted pupils. But an overdose on a stimulant, like an amphetamine, you get the complete opposite, mydriasis, where the pupils are huge and dilated. Just by looking in their eyes, the whole investigation takes a giant leap forward.
So you take that one clue, pupil size, and you start combining it with other signs, right? Like their heart rate, their body temperature, how conscious they are, and suddenly you can narrow down the possibilities from hundreds of different drugs to just a handful of categories. It's pretty amazing.
And here it is, the detective's clue sheet. Just look at how different these categories are. Take a look at the sedative row. You see things like depressed consciousness, slow breathing, and hyporeflexia. That's just a fancy way of saying their reflexes are slow or gone. Now compare that to the adrenergic toxidrome from something like amphetamines. Instead of everything being slowed down, it's all sped up. You've got stimulation, high blood pressure, a heart that's racing. See? Each row tells a totally different story.
Of course, the investigation doesn't just stop with what you can see. The next step is to get some hard data to back up those hunches. This means running things like blood tests to check oxygen levels, a urinalysis to hunt for drugs, and even an ECG to see what's going on with the heart.
Okay, so let's recap. We've stabilized the patient with the ABCs, we've done our detective work, and we have a prime suspect. Now comes the best part, using all those clues to deliver a very specific, targeted, and often life-saving treatment.
A perfect example of this in action is with carbon monoxide poisoning. Let's say all the detective work points to CO exposure. Well, the treatment is incredibly simple but so powerful. You hit them with 100% pure oxygen. It basically forces that carbon monoxide right out of their system.
All right, let's run through another classic case. The toxidrome is screaming opioid. The patient is barely conscious, they've got those classic pinpoint pupils, and their breathing is getting dangerously slow. The diagnosis is pretty clear, right?
And guess what? The solution is just as clear. You administer naloxone, which you've probably heard of as Narcan. This drug is what we call a reversing agent. It literally goes in and blocks the effects of the opioids, and you can see someone start breathing normally again in just a matter of minutes. It is a true, honest-to-goodness antidote. And what's so incredible is that this sort of lock and key relationship exists for a ton of different substances. This table here just shows you a few from the antidote arsenal. You've got stuff for acetaminophen overdoses, for benzodiazepines. For so many of the most common poisonings, there's a specific countermeasure ready to go.
So when you think about it, from the universal ABCs to the clever detective work of Toxidromes and all the way to finding that specific antidote, this whole playbook is just an incredible system for bringing order to chaos. But it does leave us with a really important question for the future. As all these new and unpredictable synthetic drugs keep showing up, how is this life-saving playbook going to have to evolve to save the next life?